The year I was examined on the boards, which was 1968, most of the people who were trained at that time were taking the boards in general radiology just like I did, which meant that we spent 1 year in radiation therapy and 2 years in diagnostic radiology. After I completed training, I decided to subspecialize in radiation oncology. See, 5 years later, whereas when I trained, most of the people who took the examination, board examinations at that time, trained in general radiology like I did. 5 years later, it completely split. The one thing that probably kept everything together was the RSNA. The RSNA had continued input and in programs for both radiation oncology and radiology. And I was interested in imaging as well as the treatment of cancer, so I continued to come and remain active in the RSNA for all this time, which is now over 30, 40 years now. The thing that's interesting is we're now at a focal point in that radiation oncology and diagnostic radiology are now coming closer together than they have in a long, long time. And that's because of the science of the field and the technology of the field. Radiation or diagnostic radiologists have developed new techniques that allow them to define the cancer much better than they used to, basically the target volume that I would treat. And radiation oncologists have developed new methods to deliver the radiation to that target volume, giving a much smaller dose to the normal tissues that are intervening and a much higher dose to the cancer, so you get better results. And so there's an increased dependence just in the past 15, 20 years at the most, maybe 10 to 15 years, in radiation oncologists becoming acquainted again with their diagnostic counterparts and more interest in attending this meeting. Obviously, it's the biggest meeting. I mean, this was really second only to the Radium Society and the Röntgen Ray Society. It started back in 1915. The RSNA did, and so that it was there at the really very soon after X-rays were discovered, and it's increased, and its impact on diagnostic radiology particularly has been phenomenal. Not as much in radiation therapy because, as I mentioned, for 25 or 30 years the two fields tended to drift apart. So it hasn't been that important until the new developments, as I mentioned before. Two things. One is the staff is superb. It's really a very well-run organization. But I think one of the things that has attracted me to the RSNA, and one of its main functions, is that it has continued to stay involved in all parts of the radiological sciences, not just diagnostic radiology and radiation oncology, but all the subspecialties within diagnostic radiology have continued to play a big part of the RSNA. And I think that there's always a danger as you develop all these subspecialties of the field fragmenting, and all the subspecialty societies go off in their own directions. I think the one thing that has kept it together, or at least one of the major things that has kept it together, has been the RSNA, because it covers all aspects of radiology. It's been in my blood for many years. I've been attending RSNA meetings now for over 40 years. And over many of those years, I was participating in committees and the leadership of the society. It's not something you get out of your blood easily. And so this has been a big part of my life. It's still a meeting that I want to go to every year. As far as cancer diagnosis is concerned, the diagnostic radiologists have improved their techniques with CT and MRI and a lot of functional imaging to better identify the cancer and better define the extent of the cancer. And radiation oncologists have developed techniques that allow us, this is with things like intensity modulated radiotherapy and proton beam radiotherapy, have defined or improved their methods, our methods, of delivering the cancer treatment to that volume that the diagnostic radiologists have outlined for us.